Knee replacement surgery, also known as knee arthroplasty, is one of the most common, safe, and effective orthopedic procedures performed today. It is done under general anesthesia, so you won't feel any pain at all during the operation itself. Having some lingering pain after your procedure, though, is normal, and the degree of distress varies from one individual to another. It's likely you'll need some medication recommended or prescribed by your doctor to deal with it. If you're younger and healthier, you'll probably experience less discomfort than someone who's older and in poor physical condition. Gradually, pain subsides, and patients can switch to over-the-counter medications for relief. Bruising may last for 1 to 2 weeks following surgery. Swelling typically lasts for 2 to 3 weeks, but may persist as long as 3 to 6 months. Following a period of recovery and rehabilitation, most replacement recipients say they experience far less knee discomfort than they did before, or even none at all. However, in a small percentage of cases, some patients continue to experience significant chronic knee pain. When this happens, additional treatment or corrective surgery may be needed.